Hallelujah. Hey, that's Right now, all over the globe, there are calls for support to assist governments as COVID-19 continues to wreak havoc on human lives. Now, the WHO emphasized the need for people to support individuals, communities, health facilities that are struggling with basic needs. Right here in Ghana, frontline health workers are calling for support. The Ghana Association of Doctors in Residency say Ghanaians must come to their rescue as they've run out of essential equipment to work with. Joining me on Skype is Dr. Bernard Hammond. He's the president of the Ghana Association of Doctors in Residency. Dr. Hammond, thank you very much for your time with us. Help us understand the reality of your situation. No PPE at all?
Okay, thank you very much for having me too. Now we are taking, how we take stock, okay? We had some PPEs, but there are also facilities scattered across the country where they don't have at all. Just yesterday, a friend of mine also called me. He's from somewhere in the OT region. He mans a facility over there. There is no PPE. His facility, his town shares a border with Togo, which we have people just crossing the border to come and seek healthcare at his facility.
Right. Now, just as you're with us, let me also introduce our other guest who joins us on Skype. Two Ghanaians who are capitalizing on the power of social media to reach thousands of Ghanaians and show them love in these trying times. The two friends are Derek Lai, who's a technology enthusiast, and Selom Brantier of Imani. He's the vice president there. And they are reaching out to Ghanaians to help them to support healthcare facilities. Derek joins me on Skype now. Oh, there you are. Good old Derek. Hello. And hello to you, Doc, as well. Nice to see you both.
Hi, Coach Joe.
Hi, Derek.
Hi.
Now, I'm really excited by what you and Selom are trying to do. But just before we learn about the details, let's hear a bit more about the problem from Doc. So what you're saying is that right now, the problem is not just with those who are on the front line treating COVID-19, but doctors across all facilities have a need for support, right? Paint the picture for us.
Yes. So, don't limit it to working with other staff. Yes, I can hear you.
Wonderful. Please continue.
Hello?
Yes, please continue.
Yes. So you have doctors working with nurses, working with other staff. They are all on the front line. And so the shortage or the absence of the PPEs is not just limited to doctors. And secondly, they are designated COVID centers. I mean, in Accra, in the Greater Accra region, you have Greater Accra Regional Hospital, that is RIG, and you also have Tema General. In Kumasi, you have basically Kumasi South, serving as a hub for all of activities concerning COVID. But our patients don't just get up when they start feeling the symptoms, they run to these centers. Definitely they will pass through some facilities before being suspected and getting to these centers. So at all these places, we need to ensure that there is some minimum number of personal protective equipment available for the frontline health workers to use. For instance, basically, what most people do is that when they start feeling these symptoms, they run to the nearest private hospital that is close by. And if the staff at this private hospital don't have these equipment to protect themselves, you end up exposing all of them there, and you are going to this is going to result in a shutdown of the facility because of the staff being isolated. So the focus is not, or the target is not just the COVID.
Right. I think you've made your point quite well, Doc. And I really get the picture of the situation out there.